Good evening, everybody. Welcome to this month's CMTA webinar, Occupational Therapy and CMT. My name is Bob Christensen. Again, I'll be your moderator tonight, and I'm going to go through a couple things here so that you understand how to work in the system. But first, I want to introduce our subject tonight. Again, Occupational Therapy and CMT, and we're very lucky to have Valerie here with us this evening, who is an occupational therapist. And has been working with people with CMT and other disorders since 2000. And I've had a nice opportunity to catch up with her beforehand. I think you're going to find this to be a really interesting presentation. One thing I want to say, Valerie's said, ask as many questions as you want as we go. And if they're applicable, I'll bring them up. We'll pause the presentation and answer whatever questions we can as we go along. We do have a bunch of questions that were mailed in earlier, and we'll get to those towards the end of the presentation. If you look at the right side of your screen, for those of you who are viewing, you'll see there's an area where you can ask questions. You can contact me that way or in the chat window if you're having any technical problems, and I'll be happy to help you out as best I can. And if you have any audio or visual issues, you may want to log out, log back in. That's always the first thing I tell people to do. If not, you can just ask me questions and so forth. And again, any questions you ask during the presentation, we'll try and get asked as we go along if there's something that pertains to a particular slide. So having said that, I am going to say thank you for joining us again, and I'm going to turn it over to Valerie. Here you go, Valerie.
Okay, thanks so much. I am really excited to talk to you all tonight. I will just tell you a little bit more about myself. I've been an OT for about 17 years, and I've been at Vanderbilt in Nashville, Tennessee about 10 of those years. And on a day-to-day basis, I work with adolescents and adults who have had neurological injury, so brain injuries, strokes, spinal cord injury. We also treat many patients with neurodegenerative diseases such as CMT and MS and ALS. So I pretty much do this on an everyday basis, and I've treated many CMT patients in my career. So we will proceed. For those of you who aren't familiar with what OT is, occupational therapists work with people who have had an injury or an illness or have a particular disability. We work with them to be more independent and function in their everyday lives. We work with them and educate them on how to use adaptive equipment as well as various techniques to make them more independent. We also work on strengthening and stretching and coordination programs, and we work with family members to provide effective caregiving that also facilitates as much function as possible. The main goal for an OT is to give our patients as much independence as possible. We want them to be able to do everything that they're capable of with their bodies. So as far as upper extremity impairments go, and pretty much we don't divide the body in half, but OTs typically spend their time working on the upper extremities, and physical therapists will focus on the lower extremities. So a lot of this talk today is going to be about upper extremity impairments. So people with Charcot-Marie-Tooth might have any of the following impairments: decreased sensation, impaired fine motor skills, weakness in their hands or arms. You may tire easily when you're using your hands or your arms, and many people end up having impaired range of motion in their fingers or their hands. So loss of sensation, this can be really painful for people, and that definitely can affect your function. This is a photograph of what we call thermoskin gloves. They're readily available on the internet, and they were originally designed for people who have arthritis because they will allow the hands to stay warm. But many of our patients tell us that their hands are cold all of the time, and so these gloves can be really helpful in maintaining the warmth of your skin, and if you're not in as much pain, then we hope that your hand function will be a little bit better. This is something that we might use for someone who has lost gross grip, meaning you can't, like, you have difficulty holding a bottle of water or turning a doorknob, things such as that. These are just grippy gloves, and you can also, these are readily available on the internet as well. And they just help you maintain a grasp of whatever it is that you're trying to hold on to without straining your hands as much. So hand weakness. This is typically very cumbersome and bothersome for people when they're trying to do fine motor tasks. So things such as turning a key in a lock, opening bottles and jars, opening cans, putting on socks, any number of things that require you to have fine dexterity. When you have hand weakness, you're probably going to have trouble with those fine motor skills. So we have a vast array of adaptive equipment pieces that might help you with that, and these are just a few examples. The one at the top left of your screen, that is a pill opener, and it is adjustable to different sizes depending on the size of your pill bottles, and it can help you grip the lid to get the top of the pill bottle off. We also advise people, if you're not living in a house with children, to ask the pharmacist to give you pill bottles that are not child-proof. Those are oftentimes much easier to open. The picture in the top in the middle, that's a battery-powered can opener for people who just can't operate a regular can opener. And sometimes we advise people to use this just to make life easier. You might be able to operate a regular can opener, but this is just an easier way to not have to use your hands as much. You can get those at Walgreens and Walmart or order them online. Then to the far right of the screen, on the top of the bottom, those are both adaptive pieces of adaptive equipment to help you hold on to a key when you're needing to turn the lock of your doors. These don't work great for these new giant car keys that we have, so we can fabricate something for those type of keys. You'd have to go into a clinic and see a therapist for that, but we are able to adapt those keys if necessary. Then on the middle bottom, that is an adaptive piece of equipment to help turn a doorknob. They make those for round doors as well as long, skinny door handles to just help hold on to it. And then on the bottom to the far left, that is a jar opener for larger items. You can also use that to open water bottles and orange juice and things like that, but what the picture shows is mounted on the underside of your countertop or your cabinet, and so then you can just put whatever you're needing to open up against it, and it holds the lid while you turn the bottom and can make the jar opening a little bit easier. So as far as self-care, so being able to do things to take care of yourself, sometimes patients have difficulty getting their socks on. If they have hand weakness, it makes it difficult sometimes to hold on to your socks. So that picture on the left is a sock aid, and an occupational therapist could easily teach you how to use one. You could probably YouTube it and teach yourself how to use it, and it's been a lifesaver for a lot of people who have difficulty getting to their feet or holding their socks. And then another piece of equipment that we like is that's an adaptive nail clippers, so that you can use your whole hand to push the clipper closed to clip instead of having to use a pitch or your index finger against your thumb, which can sometimes not produce enough power to work the clippers. So we'll move on to hand function, and many times patients have this decreased fine motor control, which really affects the ability they have to complete just daily activities. And so we're going to go through some things that might help you with dressing and putting on jewelry and managing grooming activities and things such like that. Here are just some ideas that you could consider if you're having some difficulty with your ADLs. Considering wearing Velcro or supportive shoes that are slip-on rather than having to tie laces. They make magnetic bra fasteners and cufflinks so that you can still do that yourself, and the magnet holds those fasteners closed. Wearing earrings without backs, and considering maybe wearing elastic waist pants. They also make adaptive clothing And I believe I have a photograph of that in the slideshow, but it's basically a company that makes adaptive clothing that uses Velcro but still looks as if there's buttons and zippers there. So unless you told someone that you were wearing adaptive clothing, they wouldn't know. Another good idea is leaving your ties tied in the closet. Then just all you have to do is loosen and tighten them and slide them over your head rather than having to retie them each time. And also wearing larger necklaces that will slide over your head. So those are just a few ideas. And now here's some equipment that might help you with these activities of daily living that require fine motor skills. The picture on the top left is a button hook. A lot of our patients have trouble managing buttons. So this has been very useful for many people. And then there's a picture right below it that shows it sort of in use. And what you would do is stick the button hook through the hole in the shirt and grab hold of the button, and then you just use your hand to pull the button through the hole, and then you disattach the button hook. Makes it quite a bit easier. And then on the top middle, that is a zipper pull, and so you would use the hook on the end of it to latch the hole in the zipper, and then you could use your whole hand or a gross strength in your upper extremity to zip the zipper rather than having to hold it with your fingers and pull it up. And then there's some adaptive laces on the screen. The top to the right, those are elastic shoelaces. They work well, but for people who like their shoes tied tightly, or if you have to wear leg braces, they don't work very well. So we typically suggest then that you might consider a lace lock, and that is what's below the picture of the elastic laces, that yellow. That's a lace lock that can be used with regular shoelaces, and instead of having to tie, you just push down on the button on the top and loosen them, put your shoe on, and then you push the button down again and slide it down the laces, and it tightens the laces for you. And here's a couple of other interesting ideas. That's a picture of the tie on the side, but the picture I really wanted you to see is the picture on the left. There's a company called Grommet, and they make magnets for just about everything. They can hold through up to 5 to 6 layers of clothing. So they can be very beneficial for clasps and needing to hold things closed if you're not able to do that with your hands. Those magnets can be very effective, and you don't have to damage your clothes to do so. So now we'll just move on to some physical things that you can do to help with your function and your body. We talk a lot about posture to our patients and how important it is to have good posture and core strength to your overall health. So what does that look like? Well, just imagine, trying to sit up as tall as you can and hold your head straight and having the top of your head flat against the ceiling above you, holding your chest up and making sure that you really open up your diaphragm. And you'll find that your shoulders work much more effectively if you have a strong core and good posture. Breathing also becomes much easier, as well as digestion and bowel function. Maintaining good posture helps with joint alignment, not just in your back, but it also helps in all of the other joints in the chain. So from your head down to your feet, the middle of your body affects everything from top up. So it also helps decrease back, neck, and shoulder pain. So a lot of the things that we teach our patients have to do with increasing their posture and working on core stability. Another technique that we talk to our patients about is using energy conservation. So if you're having trouble when you get up in the morning and getting everything done throughout the day because you're fatigued, using these energy conservation strategies might aid you in being able to maintain enough energy to complete everything that you need to do throughout your day with less fatigue and less muscle soreness. So here's some just general principles. Avoid rushing, trying to take your time. Typically, people have better coordination if they slow down a little bit. Take breaks, listening to your body. If your body's telling you to rest, you should just take a breather and come back to it when you're ready. Planning ahead. So if you're going to be cleaning or cooking or doing a gardening activity outside, getting all of your necessary items together before you start, so you're not running back and forth to grab things that you need. And then using the strongest joint available for a specific job. So if you can use muscles in your shoulders and your elbows rather than using your hands, you're going to conserve energy because those bigger muscles are just stronger. And then sitting instead of standing when you're able to. And then we're back to the good posture, and that will help you have better body mechanics. And then being willing to enlist help from friends and families for really strenuous activities, and then maybe considering hiring professionals to do yard work and home repairs if you just don't have the energy to get things like that accomplished. So these are two things that we definitely advise patients to do, and one of those is sitting when you're doing your grooming activities. So if you're getting out of the shower and you need to brush your hair and blow dry your hair, if you're needing to do that, to maybe sit and do that rather than standing. Sitting to brush your teeth in the evening if you're just too tired. We also tell people to think about using electric toothbrushes and razors just because it's a bit more efficient, or can be more efficient. Here's some more ideas. So using lightweight dishes and cookware make managing those items a little bit easier. Invest in a dishwasher if you don't have one. Washing dishes by hand can take a lot of energy. Sitting when you're folding or ironing clothes. Pre-sorting your laundry. So buying one of those items at the store that is already separated so that when you get undressed, your clothes go into the load that it's going to be washed in, rather than having a whole pile of laundry and you have to sort it and then get it into the washing machine. Decluttering around you, that will help when you're needing to clean. Then using lightweight and easy maintenance mops and brooms, and lightweight vacuums. Vacuuming is one of the things people tell us just is such a chore. And so trying to use a vacuum that's a little bit lighter weight, it might take you a little bit longer, but you won't exert as much energy because the vacuum cleaner is a little bit lighter. And those self-propelled vacuums are fantastic. So here's some pieces of equipment that you might put into your repertoire. That's a shower chair. I'm sure you all are familiar with what those are. You might not need to sit to shower, but you might find that if you do sit in the shower, you have more energy when you're done with your shower. So sometimes we advise people to invest in a shower chair even if they're able to stand in the shower, just because it gives them more energy throughout the rest of their day. Or if you're a person who likes to shower at night, you may be kind of tired at night. So being able to have a seat in the shower when you are feeling tired at night is a good resource to have. Then that rolling cart, we advise a lot of our patients to invest in something like this, because if you're cooking a meal, you can get all of your ingredients on that cart and push it to wherever you want to do your preparation, and you have everything there for you. Another useful thing is if you go to the grocery store and you get 12 bags of groceries, you can run into the house or into the garage and get the rolling cart, put your groceries on the cart, and get them into your house if possible. And then for people who have assistive devices for walking, we typically advise them to get something that is similar to what's there on the right side of the screen. That's a walker basket, but they make carrying devices for pretty much any type of assistive device you might be ambulating with to help carry things from one room to the next. Now we'll switch topics. Something that OTs do very regularly is splinting. So we might be splinting for any number of reasons. One of them might be to provide support to a weak joint. One of the reasons we might provide a splint would be for stretching or maintaining or to increase range of motion. And the purpose of the splint will dictate whether you're wearing it during the day or using it at night. Typically, we don't recommend that you do both. So here's an example of a thumb spica splint. This is a custom fabricated thumb spica splint. An OT or a hand therapist would make this for you in a clinic, and this would be used for someone who has unstable thumb joints or pain in their thumb. to help them better use their hand without creating further damage and just providing support to that joint. This is a wrist caucus splint. We might issue this to somebody who has weakness in their wrist but still has really decent hand function, but their wrists get very tired. So this is something that you would wear during the day while you're completing activities that will help support your wrist so that you don't get overly fatigued. What's in this photograph there is a custom-made wrist caucus splint that would be made, again, by a therapist. They also have over-the-counter splints that can be purchased that are a little bit softer than that. This is a resting hand splint, and this type of splint would be used to provide stretching in order to maintain or increase your range of motion. This type of splint would certainly be worn at night. We would discourage using this during the day because we want you to use your hands during the day. So we would work with the patients to have them begin to sleep in these. Again, this is a custom fabricated resting hand splint. They do sell splints that you can buy over the counter. You do need to have a doctor's prescription for it if you want to try to get your insurance to pay for it. But if you wanted one that was custom molded to your hand, you would need to see a therapist for that. These next pictures, these are splints that are designed for specific joints in your fingers. People who have deformities because they have intrinsic weakness in their hands, or basically you have little tiny muscles in the top and bottom part of your hand that either open your hand or close your hand, and depending on where your weakness is would determine which side of the finger you wore the splint on. These splints can be worn throughout the day. They allow movement, so they don't prevent you from being able to use your hands. They just provide support to your joints. The picture on the left, that's an oval 8 splint. You can order those online. We wouldn't advise you to do that without consulting with a therapist first, but you can. You can get online and order them based on your ring size. The splints that are on the picture to the right that are silver, those are called silver ring splints. Those are a bit more expensive, but they're, as you can probably guess, they're more durable, and they look a little bit like jewelry, so they don't seem so splintish because this would be something that you're wearing all day. And in order to get silver ring splints, you have to have a therapist size you for them, and then the company would mail the splints to the therapist that sized you, and then you would go in for a fitting to make sure that they fit correctly. Unfortunately, insurance does not typically pay for these types of splints. That being said, that you can certainly attempt to get your insurance company to cover it for you. It's not unheard of. So now we'll talk a little bit about driving. A lot of OTs, not a lot, that's an exaggeration, many OTs will work with their patients on driving. And if you have some impaired sensation in your feet, weakness in your ankles, or you have difficulty with your hands, you could continue driving with some adaptive equipment. You have to be evaluated and trained by a certified rehabilitation driving specialist in order to use this equipment legally. So you would have to get your physician to write a referral for a driving evaluation, and then the therapist would evaluate you using the equipment, and then they send a letter to your the Department of Safety in your state, and that gives you the authority to use those controls. Again, this is not something insurance covers. You have to pay for the equipment out of pocket unless you just have an unusual insurance benefit. And not all certified driving rehabilitation specialists are OTs. You can become a CRDS just by going to the school and getting certified. So you have to do some research wherever you live to find a driving specialist that could teach you to use this equipment. You do have to have a doctor's order to have an evaluation. We have 2 OTs in my clinic that do these driving assessments, and then there's another person that's in private practice in Nashville. So just in Middle Tennessee, we have 3, but we have patients come to our clinic from all over Alabama, Georgia, Kentucky, because it is kind of a unique skill set and can be challenging to find someone who's actually certified to teach you to use equipment. So you should do your research. Here's some pictures of adaptive driving equipment. They're not great photographs, but you kind of get the idea. The picture on the left, those are hand controls. So this would be someone who was no longer safe to drive with their feet for whatever reason, be it impaired sensation or you don't have enough movement in your ankles anymore to control the gas and the brake with your foot. They install hand controls so that you can control the gas and the brake with the hand control on the left, and then you would drive with your right hand. Many people learn to use these without much difficulty. The picture in the middle, that's a left foot accelerator. So if you notice in the picture, his foot is on the brake. The existing gas pedal is still in the vehicle, but they've added a bar, and the adaptive equipment company would do this, but they would install it for you. This might be for someone who only had weakness in their right foot and just couldn't drive safely with their right foot anymore, and your left foot is still working fairly well. Then you could use your left foot to control the gas and the brake. And then the picture on the right is a spinner knob. These were very popular years ago, and I think probably to an extent people still use them, but in the state of Tennessee, it's illegal to use a spinner knob unless you have a physician order for it. So basically, to get one, you have to go through the driving assessment and be trained to use it. And the reason that you might need a spinner knob is if you're having to drive with one hand. They can be very useful when you have to make full turns with the steering wheel. Okay, I think that is actually the last of the slides. So I am happy to answer questions now.
Well, thank you very much, Valerie. We get a bunch of questions in, so I'm going to just go through the list. We can take them one at a time.
Okay.
And see what we can do, okay?
Okay.
The first one is, are there specific side effects from lower leg? Cock-up splints, I'm not sure what that means, but such as worsening neuropathy, edema, or skin changes. And I myself wear splints on my, or braces on my legs, and I've often wondered if that had contributed in any way to, continued weakness.
Right. That's a really good question. So as far as peripheral neuropathy or it affecting your skin or your sensation, it really shouldn't. If you're new to wearing braces, you have to be very mindful of monitoring your skin or any changes of swelling or if the braces are rubbing you in a way that's uncomfortable. And we do get people who are afraid if they start wearing braces, then they're just going to continue to get weaker, or their ankles are going to get weaker faster because they're now dependent on braces. And, we would advise people to continue to exercise their ankles and, keep their muscles as strong as possible. And if you do that, then you shouldn't have an expedited weakness of your ankles. And if you need them to walk safely, it's kind of a give and take. You have to be safe to be able to walk around without, falling.
Okay, well, let me continue, because since we're talking about the peripheral neuropathy in the lower legs, and I know you specialize more in the hands and
Sure.
so forth, but a lot of people, myself included, get this burning pain in the lower extremities.
Right.
Do you know anything, do you see that a lot in all neuropathies? Is that a CMT thing?
No, that is a neurological thing. The burning sensation is indicative of a neurological pain. So nerves, when they are damaged or injured, the pain response is that of burning, a burning sensation. So it's a different kind of pain than if you, pull a muscle or break a bone. The pain is very different. So it's definitely not just isolated with CMT. Many people who have had neurological injury have neuropathy.
Okay. We get a couple questions coming in online here too, and can you, difficult question here, and maybe you don't have a good answer for this, but somebody's asking how much support for someone who has CMT, and I gather maybe it's a parent or somebody is trying to figure out how much support can you give somebody who has CMT, and what is going overboard, and where do you push people, and how do you find that, that line between
That happy
what's right and
medium.
wrong?
Sure.
Yeah, exactly.
Yeah. Well, that would be a good place, or an indication that maybe you would need to see a therapist, because as therapists, we can evaluate the patients from an objective standpoint, and it's really hard as a family member or caregiver to see someone struggle, and we try to educate people to not step in so quickly, and perhaps allow someone to struggle just a little bit before they just jump right in and do it for them. So my suggestion would be, if it's something having to do with dressing, bathing, grooming, feeding oneself, those kinds of things, I would recommend being evaluated by a therapist, because the therapist can then help you make decisions about what your family member is actually capable of and what you really should be helping them with.
Yeah, I think it has a lot to do with the individual too, right? Some people want more help. Some people just want to be left alone and really gut through it themselves, I guess.
Very much so, yes.
Yeah. So we have another question here. Do you know anything about chemotherapy on CMT patients? Have you seen anything like that?
Was it chemotherapy?
Yes, chemotherapy.
I have heard about some, like, similar to, it's not exactly chemotherapy. They're doing some immunotherapies at Vanderbilt. So yes, I have heard of it. Am I familiar with how well it works? No.
Right.
That would definitely be a question for a physician who's better up on the research.
I think the question maybe is the other way around. If somebody is getting chemotherapy, do you see an increase in neuropathy
Yes.
in patients with CMT, or I guess any of your patients?
Yes, absolutely. Anytime you're having a drug entered into your system that's designed to kill cells, it can definitely have an adverse side effect. So yes, people will have increased weakness. They'll feel just overly fatigued. Even the smallest thing can feel like they have to go back to bed after they get up and get dressed. So yeah, I wouldn't be surprised to see that as a side effect. And then you hope after the admission of the drug and some time has gone by that you begin to see the positive effects and you get your strength back. But I would absolutely expect to see some negative side effects.
Okay. Another question here online. Is there a good combination of wrist splint and some Spica if you have both weakness in your wrists and some pain that goes along with it? Is there like you showed two examples, if I recall correctly, one of the thumb splint, one of the wrist splint. Is there some sort of combo?
Yeah, they definitely can make a brace that would, quote unquote, kill two birds with one stone. You would have the wrist cock-up splint made, and then they would attach, also have a thumb component to it, so it would kind of look like meshing those two splints together. But you would, and you can, they make some over-the-counter some Spica braces that go all the way up past your, like to the middle of your forearm or closer up to your elbow, that would also provide a dual purpose. So yes.
Okay. So I have two questions here that kind of go along the same line here. And the first one is, should a person start occupational therapy or physical therapy as a preventative measure? But maybe before we even get to that, someone has asked, what is the difference between an OT and a PT?
Okay, so a physical therapist or a PT works on walking, leg strength, balance. They would work potentially closely with an orthotist if someone was needing braces. They work on teaching people to safely navigate their environments with adaptive equipment. So if you have to use a walker or you're in a wheelchair, they do a lot of mobility training and working on stairs, getting in and out of cars, getting in and out of bed, those type of things. So a lot of mobility and balance and strengthening your legs and working on just overall endurance. An occupational therapist works more with being able to take care of yourself. So being independent with dressing, bathing, grooming, feeding yourself, using your keyboard, driving your car. So we kind of tease our PTs that you help the patients learn how to get in and out. We teach them how to drive it again. So and there's a lot of overlap in what we do when it comes to strengthening and getting core stability and endurance and safety. We kind of, both of us work on those kind of things, but an OT will work more on making sure that you can safely take care of yourself. And we work on fine motor skills and work on vision and cognition as well, whereas that's not really in the scope of practice for a PT. Does that answer the question?
Yeah, but
Okay.
would you ever see an OT or PT sort of as a preventative measure to try and, you know, lengthen that time before you really need treatment?
Yes, I think seeing a therapist at diagnosis, or when you just start to maybe notice some subtle difficulties, is really beneficial, because you can get baseline measures of strength and balance and sensation and what you're able to do, so that for reference back when you return to the therapist later. It's also beneficial to get safe exercises and what are good stretches, what are bad stretches, how can I maintain my tissue length and make sure that you are able to use the movement that you have and not get impairments in your joints. And then starting a safe endurance program. You know, I think a qualified therapist could definitely help someone do that safely. We oftentimes see people just for 1 or 2 visits, just to, you know, kind of give them some things to work on at home and show them some pieces of equipment that might be beneficial. And then, you know, they might come back in 6 months or a year, and we do it all over again based on where they're at that point in time.
Okay. Here's an interesting question. I mean, if somebody has carpal tunnel syndrome and CMT, first of all, you know, I don't know how that's diagnosed between the two, and do you have any idea what roles each would play in, you know, like reducing hand muscle strength or coordination in the hand?
Sure, that's a good question. You can actually get carpal tunnel from your CMT, because CMT causes the loss of the nerve axon and the myelin sheath, which causes the nerves to slowly degenerate. So with carpal tunnel, it's a specific nerve. So your median nerve that runs through your wrist and supplies sensation to your thumb and your index finger and your half of your long finger, that's your median nerve. So people who have just carpal tunnel, they get compression on that nerve for whatever reason, be it inflammation or positioning or some kind of trauma to that specific nerve. So then if you have CMT and also carpal tunnel, it's probably, in my book, likely that your CMT has caused your carpal tunnel. But it just depends on which nerve that your CMT has affected. But both cause decreased hand strength and will make the muscles in your hand atrophy because they're not getting, you know, the nerve impulses into the muscle bellies to make them fire. So both can present the same way.
Right. Okay. Here's somebody who has pain at the base of their thumb and wrist because of weakness in the hands. So I guess this goes back to the bracing question from before. They're using over-the-counter braces right now. But would you, suggest they see an OT to try and get a custom brace made for this sort of thing?
Yeah, I think if you're having difficulty with ones that you've purchased, you can absolutely see a therapist and have one custom made for your hand. Now that would be made out of thermoplastic, which is hard, rigid material. So if that's the type of material that you have difficulty with, I would maybe try a neoprene thumb spica splint, and you could just Google neoprene thumb spica, and several will pop up. Those don't have metal stays in them. So the ones you buy in the store have metal underneath the fabric to kind of prevent you from being able to move your thumb. The neoprene splints just provide support, and they don't inhibit movement, and they don't have a metal stay in them. Another suggestion might be if you have one that you've already purchased that's not comfortable because of that metal stay, you can, like most of those, you can take the metal piece out and just use it as a support without the metal in it. So I might try that before I invested money in something else.
Okay. Is there anything that a person should tell an occupational therapist about bracing in a particular way so that it works well for them? I mean, do you guys work, when you work with a patient, I gather you do whole history, and do you make braces specifically for their needs as as they use them, or are they kind of like a one-shoe-fits-all?
No, we make them based on what is your limitation right now? What are you having difficulty doing? Which joints are not stable? Where is your muscle weakness? Where are you having pain? It's absolutely individualized when you come and see a therapist. We would only make you a brace that works for you. It wouldn't work for anyone else. If I custom made you a splint, it's very unlikely that it would fit anyone else comfortably.
Okay. So here's an interesting question, and I'm sure visiting you would be the appropriate answer, but how does someone really know if they have the correct occupational therapist who has experience with, Charcot-Marie-Tooth and can really help with, because we're all kind of a little different, but we all share that same specific set of issues?
Yeah. So some good questions that you can ask are how much experience does the therapist have? And it's been my experience that you can have a conversation with someone, especially people who have a disorder or a disease. You can have a conversation with someone and figure out in about 5 or 10 minutes whether they really know what they're talking about or whether they're just winging it. You don't want to see a therapist who's just winging it. And it can be hard to find a therapist who has treated or has experience with your specific disorder. But I would absolutely find out how much experience they have treating neurological diagnosis, because it is important that you find a therapist who's not just winging it, or they actually have a good understanding of how this disease affects your body and how those impairments can affect the ability you have to care for yourself.
Right. Now, I would say to the person who asked that question, everybody out there, that the CMTA website has a Centers of Excellence page on there, and you could find a lot of information about where you can get appropriate care and follow up to find out where you can get treatment. And it's throughout the country, so it's a very handy website, and that's the cmtausa.com. So moving on, is there a website that you know of to help locate somebody who can do the vehicle controls? Is there like a place to go, or do you just have to Google search local stuff?
That's a really good question, and I should have asked that to my driving therapist that I work with. I believe that there is a ADED association, which is ADED, and they do have a national organization. So my bet would be that you could go on the ADED website, and they could provide you with the list of certified driving specialists in your area, or at least a reference that you could contact to find out if there is someone in your area.
Okay. So I have somebody here, and I know it's a little outside of your area of expertise, talking about bracing on the legs. Mm-hmm. But as they're getting, I guess, as the disease is progressing a little bit, they're feeling a little bit more wobbly and feeling like they're falling backwards when they're trying to stand. And wondering if they're thinking, about strength training or bracing. When do you think is like an appropriate time to look at these options?
I would say that you should, my recommendation would be that you ask your physician for a referral to see a physical therapist. They will be the best person to, one, work on helping you be more stable, and two, help you make a decision if it's time to pursue getting braces and work with you on learning to walk with them, or if you don't need them yet, helping you keep your strength and stay ambulatory without braces.
Right. Okay. And then we have another question. This is the last question I have currently, but they've been popping in very quickly. So this person suffers from a weakness in their hands and is trying to decide whether to kind of push through it or get help. And I guess this goes back to that earlier question, how much help should someone give someone who has CMT? And right now this person is having their partner help them with buttoning shirts and so forth and so on. But they're trying to figure out whether it's worth the effort to, just keep trying to do it themselves, or when do you reach that point where you start to do these things?
I think there's a lot of different approaches to that question, and your decision should be based on a lot of things, based on how important is it to you as a person to be able to do that for yourself, or are you perfectly okay with letting somebody do it for you? Do you have the financial resources and insurance to cover seeing a therapist? Unfortunately, many of the pieces of equipment that are designed to help with dressing are not covered by insurance. So now you can get a button hook for about $10, but some of the equipment can be rather expensive. So it's really a personal decision based on how many resources you have. And if you really, really want to stay as independent as possible, an OT can absolutely help you figure out how to do that as financially, fiscally responsibly as possible.
Excellent. Well, I think that's all the questions we have for this evening. I just want to say thank you very much. I myself was doing a lot of screen captures as you went through here, so I think I'll be doing a lot of research on all of these things. And I think it's the first time that I've had an occupational therapist on here giving such a detailed presentation, so it was great. And
well, thank
I'll leave it up
you.
to you if you have anything else you want to throw out there.
Well, what I can say is I am happy to help anybody that has questions in the future. My email address is super easy. It's just my name, which my Valerie is spelled oddly. Thanks, Mom and Dad. But so it's valerie.hanks@vanderbilt.edu, and I am happy to answer questions you can send me via email. And there's the reference page that you see on the screen now with all those websites. I can send those to anybody who might be interested in looking at equipment, or if I can just answer questions. And Vanderbilt is listed on the CMTA website as a center of excellence, so you could probably find me that way as well.
Valerie, thank you very much for your time. Greatly appreciate it.
Thank you.